Good morning. This is a report on Jim or Janet Owens. The patient is Janet or Jim Owens. They're 50 years old. They were admitted for pancreatitis exacerbation and acute pain control and drainage of ascites, which has now been completed. The patient has a history of hepatitis C and is a recovering alcoholic, has liver cirrhosis and chronic pancreatitis. 5 liters of fluid was drained from the abdomen and was replaced with 30 grams of albumin, 25%, to account for the intravascular fluid volume shift and to support circulatory stability. They tolerated the procedure well. The patient has a son who lives out of state. The son checks in every once in a while, but they have a poor relationship in general. The spouse died about 2 years ago. The patient has an allergy to Demerol, which causes itching. They are a full code status. Last vital signs were 98.8, blood pressure 142/84, heart rate 88, respirations 22, and saturations 96% on room air. The pain rating was a 7 out of 10, and they're due for their hydromorphone. The pain drops to about a 3 out of 10 after receiving pain medication. The IV is a 20 gauge in the right forearm. Right side abdominal 4x4 dressing is covering the paracentesis site. The dressing was last clean, dry, and intact. The IV fluid running is D5 half normal saline with 20 milliequivalents of potassium at 125 milliliters per hour. They do have bathroom privileges, but they are a moderate to high fall risk and in standard ventilation precautions. Neurologically, she's intact. Cardio, the heart rate is normal, but the blood pressure has been high. Lungs are clear to auscultation bilaterally. Their respiratory rate has been slightly elevated due to the enlarged ascites. The abdomen's enlarged, possibly fluid-filled. They do have the dressing from the paracentesis site and has approximately 2 inches of yellow drainage. The skin is yellow, dry, but intact, except for that right paracentesis site. She moves without help, mostly because they refuse help. They're slightly anxious and agitated. They want to know when they can leave the hospital. The diet, tolerating food, no nausea reported. Blood glucose has been stable. The electrolytes were within defined limits, and the patient's liver function tests are elevated as expected. They're stable, but having pain. All of the other morning medications were administered. The recommendation is to do the head-to-toe assessment, provide pain relief. I would not go into that room without the medication. They are demanding the medication every 3 hours as ordered, and he or she will know it is time for that medication right now.